topic is ocular trauma and insurgency and proxy war environment.
Yes, sir.
Epidemiological study,
Yes.
2008 to 23.
Good afternoon.
Please start.
Everyone. Yes, thank you, sir. Good afternoon, everyone. Sorry for the last minute adjustment. I just got the permission to present this.
That's fine.
The topic is epidemiological study of combat ocular trauma in counterinsurgency in proxy war environment in scenario of last 16 years study. So this was a retrospective study. Data from 2008 to 2023 was collected and was evaluated, and all the hospital admissions. Total of 948 patients were evaluated at my center, that is 92 base hospital, which is situated in Srinagar. They were evaluated initially based on the severity, whether only anti-segment injury or post-segment injury as well, and they were given primary care and then referred to further higher center based on the severity. So this was the incidence of combat ocular injuries in the previous study, which was conducted from 1992 to 2004. So this was the initial part which helped me to do the study, to continue the study from 2008. That's the data I could gather. So coming to the incidence of combat-related ocular injuries, it was only 3% in Indo-Pak War. It increased to 4.8, 10.5, and 15.8 in Iraq-Afghanistan conflict. See, what becomes most important when it comes to combat injuries, the projectiles which come, any blast, okay, affecting the periphery, any part of the bodies, it will be a smaller injury. But since eye is a small structure, any smallest of the foreign body falling into the eye or going back, it causes a severe injury, including in case of a grenade blast or any UBGL injuries. So the ocular trauma and counterinsurgency, the factor which can be considered in transporting, like how early the patient reaches. Not all the conflicts are happening in Srinagar, that I am taking care right away, that they'll reach me in another 10-15 minutes. They're sitting somewhere far off, taking about, even if they're taking by air also, they'll reach about minimum 6 hours to reach me. So the factors which were considered was casualty transportation. The evacuation time also mattered. Even though we could give the early treatment, the patient could recover, and the medical equipment limitations and initial assessment limitation. And you are evacuating a casualty in an environment of war. So there is active war is still going on, and you'll have to evacuate the patient, prioritize, because life, limb, and the site. This is the order of priority of transferring the patient. These were the year-wise case distribution from 2008 to 2023, and to be more precise here is the open globe injuries incidence is decreased in the last 3 to 4 years. The ranges of closed globe injuries and more of training-related injuries is increased than compared to the actual combat scenarios. The closed globe injury which we saw at my hospital, blunt trauma was 407 cases, accounting to 47%. Coming to splinters, 135 cases, and IED leading to closed globe injury were 10.46, and firing related injury were 26%. And open globe injuries, firing accounted for about 20%, and blunt trauma leading to open globe injury was 21%, stone pelting, and firing the blast and splinters thereafter. So combat related injury are still in the rise. Let it be, even though the shift is from closed globe injury has changed to open globe injury, so open to closed globe injuries, but the injuries are still there. It still leads the serving soldier being morbidity. He'll not be fit to serve, and preventable, and all these injuries are preventable. If only we can use more better glasses, protective glasses, we can prevent the injuries, and military eye combat protection devices can be given to the soldiers to prevent injuries. Thank you, and so sorry for the short notice.
No, that's fine, thank you. We just want to know a little more about it.
Yes, sir. Yes, please.
Yeah. So this is a study conducted by you.
Yes, sir, this is a study. So, yes, sir.
Have you been serving
I've been there for the last 2.5 years at Srinagar.
Okay.
And
so this is a retrospective study from that particular base hospital.
Yes, sir. Yes, sir. It is one of the active Northern Command theatre.
And these are all
so mostly
soldiers,
yes,
or
sir, mostly Mostly soldiers, sir, because there includes Central Armed Forces as well as BSF, military as well as paramilitary.
Military and
Yes,
paramilitary.
military as well as paramilitary.
Okay, and like, what do you feel was the time between injury and presentation to you?
Sir, if the initial thing is where IMOs are situated, the medical officer who assess the patient are also in a place where there is no network.
Yeah,
They'll have to walk minimum 10-15 minutes to reach to a point where they can get network to send me the photos, just to tell ki whether even though they can tell it's an open globe injury, and there are many issues.
Yeah, of
that
course, that's what we want to know.
So for
Because
to
these
transport
are,
the casualty, and
I'm sure you are working in a very difficult situation, and that's why we want to know more about it.
yes,
So you have included stone pelting as well.
yes, sir, stone pelting.
Okay.
Even though the incidence is decreased
Yeah.
drastically from
Yeah.
what it was before,
Yeah.
but they're still there. All these data.
So, what
Sir,
kind of?
I'll tell you the most recent case which I had was a case of LASIK flap dislocation. I've made it as a poster as well. A serving soldier, 6 years old, surgery. He was doing something and he ended up with LASIK complete dislocation. The MO took 6 hours to transport the patient, and as soon as the patient came, we took him to OT and repositioned. Everything went in.
That's
went
good.
fine.
That's good. But do you take people in armed forces with LASIK?
No, sir. It is initially, it is not, it got missed somehow, but
Yeah, like
Yes.
otherwise I think it is a
high, sir.
contraindication,
They're
or
unfit.
there is some relaxation for
Yes.
to do a
For all.
particular power or
yes,
something?
yes, sir.
Okay. And any particular, like, I think you might be knowing more of these guidelines, but
Yes.
any particular power and any particular procedure is
Sir, for officer entry for NDA, different for if you're
Okay.
joining NDA, IMA, and technical as an AMC officer, they're different. For
there are different
yes, yes, sir.
criteria
Yes,
for
sir.
all.
Yes,
Okay.
sir.
So on an average, it is about -4 or
Yes, sir.
less.
-4 or less. Both spherical as well as cylindrical, including cylindrical power, it should be -4.
Okay. And you include flap, like you allow flap
No,
or
sir,
only
we don't.
PRK nowadays?
No, sir. None of the refractive, for serving soldier, none of the refractive error is allowed. None of
Okay.
the refractive surgery is allowed. But for officers, LASIK should have been done 1 year prior. Not
Any kind of LASIK?
yes, any kind of refractive
LASIK?
surgery should have been done 1 year prior.
Okay. Prior to the entry?
Prior to the medical he's getting.
Medical
Yes,
history.
not it should not be a recent surgery. And age of the patient should be more than 18 years.
Of course, of course. That's so for NDA, like at the entry, only the medical will be done.
Yes, yes, sir. For everybody, all of
For
us,
everybody,
yes,
like,
all of
because
us undergo
those
proper-
are the people, I think they join after +2 or something.
Yes, +2, yes, sir.
Yeah.
All of them will undergo proper medical evaluation and then.
So for your kind of patients which you were getting,
Yes, sir.
what how much first aid or what kind of a treatment you could give, and how many people needed referral?
Sir, initial treatment though we gave it to everybody. Primary repair, wound repair though was done for all the patients. No
Okay.
patient was referred without primary repair, especially in case of closed lobe injury, open globe injury. And closed lobe injuries, if we are suspecting retinal detachment, retinal dialysis, we do refer them. We have referral system. We have a higher center, AHRR. That's the apex center for us. Army Hospital, RNR.
R&R.
Yes, sir, Delhi.
Okay.
We were referred to them.
So that is the nearest
Yes.
referral
Yes,
hospital
yes,
for
sir.
you.
Yes, sir, referral hospital.
Okay, good. And this is Northern Command Hospital?
No, sir. Yes, it's in Northern Command.
Northern
Yes.
Command, basically. So it's fully equipped with to handle interior segment,
Yes, sir. Can handle entries. Yes, sir.
not the posterior segment.
No, not the posterior segment.
Okay.
So,
So we wish that you get trained in posterior segment
Yes.
and serve us.
yes, sir.
Thank you.
Sir, thank you. Thank you so much. Thank you.